Montanari 1928, carried out probing of the right heart on animals and on the human cadaver. Werner Forssman 1929, self-catheterized his right atrium via his antecubital vein using ureteral catheter to obtain a mixed venous blood sample. Brenner 1935, postmortem study found no evidence that pH was due to syphilis. He described pathology of the small muscular arteries and arterioles. Werner Forssman, André Frédéric Cournand, and Dickinson Richards 1956, awarded the Nobel Prize for Medicine. H.K. Hellems and FW Haynes 1950, measurement of pulmonary capillary pressure in humans. Dresdale 1951, FIRST clinical diagnosis and further hemodynamic description of primary pulmonary hypertension. Paul Wood 1952, demonstrated vasoconstriction of pulmonary arteries in patients with pulmonary hypertension in response to hypoxia. Lategol and H Rahn 1953, use of FLO-directed catheter to measure pulmonary vascular resistance. Heath and Edwards 1958, FIRST histological classification of hypertensive pulmonary vascular disease in patients with congenital heart disease. 1960s, Aminorex, the appetite suppressant used to aid weight loss, found to be associated with pH. Actions include release of norepinephrine at nerve endings and increase in serotonin levels. Aminorex was withdrawn in 1968. Pulmonary artery lesions at autopsy were identical to lesions found in pulmonary arterial hypertension. Ganz and Harold Swan 1970, multilumen, balloon-tipped catheter to measure pulmonary artery and wedge pressure simultaneously at the bedside, positioned by hemodynamic recording. Second epidemic of drug-induced PA 1990s, dixfenfluramine and phentermine, fenfluramine, fen, led to a 23 times higher risk of PA and cardiac valve disease in drug users compared to age and gender-matched controls. Both drugs were withdrawn in 1997. Mechanisms of drug-induced PA remain unclear but are possibly related to a combination of genetic predisposition and the drug's effects on serotonin uptake.